Hello and welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. Now today on the program, we're taking a look at the dreaded disease which is now gaining grounds, breast cancer. The United Nations says over 2.3 million cases of breast cancer are diagnosed each year. Breast cancer is the first or second leading cause of female cancer death in 95% of countries. 80% of deaths from breast and cervical cancer occur in low and middle income countries. To further explore and understand this disease, I have joining me Dr. Chinedu Simon, a radiation and clinical oncologist at the National Hospital, Abuja. Welcome on the program, doctor.
Thank you, Aisha. Nice to meet you once again.
Right. But before we take our guests for more insights and perspectives, let us go on the streets of Abuja to hear from residents of the FCT to know about their level of awareness of the dreaded breast cancer disease and also take a couple of facts about the disease.
It's actually very, very prevalent. There are cases of plenty, numerous cases of breast cancer. And I think it has so much to do with ignorance on the side of the populace, the Nigerian populace. They are not aware of what breast cancer is all about, you understand? And that is why the cases is actually very, very much. I feel it's actually early detection. As a lady, you should... it's more prevalent in ladies, of course, as you wanted. And they should actually examine themselves by themselves, always trying to observe where there is something, maybe something goes wrong with their breast and all that. Yes, as I'm examining the breast, knowing that, okay, this is abnormal, there's an abnormal growth in my breast is very, very paramount. And once you do that kind of sort of examination, I feel that once it's detected early enough, it's not usually a problem. It's only a cases where it has actually become very, very severe. And late detection also, that's what causes problem in case of breast cancer. Any sort of cancer is a very, very difficult, is a very, very expensive procedure. Any procedure that has to do with cancer, even the management of cancer also is expensive. Yes, government are supposed to, in their own way, help intervention. There are a lot of people that die through cancer in Nigeria and nothing is done about it, simply because they cannot afford the treatment. Most of these, terminal illnesses, they are very, very difficult to cure. So when someone have that kind of problem and the person cannot maybe take care of themselves because of course, you know how the financial situation is in the country, the person will just relax at home and wait for death to come and meet them. So of course, if there's any way government can intervene, they can help the populace to help them at least to subsidize in terms of treatment for such kind of ailments.
Breast cancer, they say ignorance is a disease. When people are not aware, even when they see the symptoms, they may not know what it means. Some can even say it's witch from their family or just enemy has fired the arrow at them. But when they are educated on it, so know the symptoms. When they see it on their body, they will know that they're supposed to seek for medical attention. And another thing I want to say is that the government is supposed to help people, because to assess that treatment or even test may not be easy. It can even scare many women away. But when they subsidize maybe the treatment and the tests, then everybody loves to live and take care of your children, because I can see that the thing is more rampant among middle-aged women. So if, as we love our children, we would like to stay and train our children and also eat the fruit of our labor. So as long as the treatment and tests could be affordable, many women would like to do so that they will live and train their children.
Breast cancer, I think what needs to be done is more awareness. A lot of people are not informed, and especially from the northern side. I don't know, probably I'm not used to the south, but the northern side, people are not aware. People still feel they don't even know what breast cancer is. But here in Abuja, we are doing well. We had a cancer walk actually last week. I participated. I always participate. We did last year. We always do that. So aside the awareness, I think this is the kind of subsidy Nigeria should be talking about. If they have removed subsidy on fuel, they can subsidize these cancer treatments, for the common man. So because it's not, from what I know, it's not cheap. It's not cheap. So even if you help somebody to detect it early, if he can't afford the treatments, you are basically letting him to die. I think door to door, just like in the case of polio. I know since when I was a child, these guys, they come knock on your door, they explain to you, and then they use our native language. They don't use English. In the north, they come and speak Hausa. Okay, we are from so and so and so and so. This is my ID card. Yeah, then this is polio. This is what polio means. This is what polio has done to others. This is all you need to do. And I'm sure I have a friend in primary healthcare. The last time, Nigeria is almost like 0% in terms of polio. So if they can do something like that, door to door, go to all the like we are informed. I'm on social media. I'm in Abuja, but these guys living in the rural areas, they don't even have access to social media. So you need to go to their doors in their native languages. If you are going to the Igbo land, speak Igbo. If you're going to the Yoruba land, speak Yoruba. Tell them, let them be aware. Okay, this is what needs to be done. This is how you're going to know. We can give you this treatment free, and then this is what needs to happen. So if so and so and so, that's what they can do in the immediate for now. If you're well informed, even if you can't afford the treatment, there are things you can do to mitigate, to ease the pains and stuff. And they need to be shown more love, more care, and stuff like that.
Breast cancer, I think it's a lump that grows up on the breast of a woman. Yeah, most of the time it's a result to operating it and cutting off the breast. Yeah, so most women don't know when this thing starts growing. That's because some women don't regularly check their breast. So I feel like women should often massage their breast, and if you feel any pain, they should talk to your doctor about it. So yeah, when you notice these symptoms earlier, it helps you more to treat it in order not to get to the operative stage. I feel like families should give more emotional support, yeah, psychological support. It's not easy dealing with cancer, breast cancer. Yeah, there shouldn't be stigmatization. Yeah, stigmatization. Nobody should stigmatize them for breast cancer because it could happen to anybody, right? Yeah, so emotional support and psychological support.
Breast cancer is real. It's real. It's very real. So one must be very, very careful. If you sit down in your house, if you sit down like that, sit down and be assessing your breast. Any issue, if you are sense that there is seed inside your breast and it is painful, you have to run to hospital. Secondly, don't be putting money on your breast, and be free your breast sometime, especially this season we are entering. The reality is breast cancer is real. Assess your breast all the time as far we are a woman.
The truth is that most women don't detect it early and they will not know about it. As a lady, normally as a lady, if time to time, if you have the knowledge, it can be as in there's a way of massaging your breast to identify some lumps in your breast. And if you don't have that knowledge, it's better once in a while you go to the hospital to like check on your breast to avoid such things like breast cancer. It's a deadly disease. If you get to a stage that you cannot control, it kills.
Concerning the awareness, I think it has to do more with going to the rural areas, to sensitize them about the breast cancer. I know many in our rural areas will never know, or except those ones that have their privilege to have children that are enlightened or educated. So I think the best thing is to enter the rural areas, sensitize them from there. I think that will do a lot more to create that awareness. And also, I think also another thing again is to possibly sensitize them on what causes it, the cause of breast cancer. Because I think recently I heard that Nigeria has become, by research, Nigeria seems to be the highest in when it comes to cancer, anything cancer. These days we have a lot of non-governmental agencies, even individuals that are ready to partner with institutions or bodies that are available to help the treatment and cure of this of breast cancer. There are a lot of individuals, a lot of organizations that are ready to donate, to partner with people that will come up to say they want to see how they can stop or avert breast cancer. The truth remains, we cannot deny the fact that it has a spiritual undertone in some persons, while the facts medically we cannot deny going for medical checkup is still key, because God is the one that gave those doctors knowledge, wisdom, and they've been handling this sicknesses. So we can't deny that fact that people should go for checkup. Then I think coming to the area of support, agencies should come up with the idea of going for screening. I know of cervical cancer. I went for a program. The person just opened up, brought in people to screen for cervical cancer, and that was how some of us partook of it, aside going for medical checkup. So this, in a way of looking for the solution, people, governmental, non-governmental bodies can go to some of these villages just to screen for it.
Welcome back. If you're just joining us, this is the program Healthy Living on Trust Television. And I told you before we went on that break that we have a guest in the studio who is Dr. Simeon Ariwa, who is a radiation and a clinical oncologist at the National Hospital Abuja, to help us shed more light and perspectives on breast cancer. Now, I'd like us to start off with what this breast cancer is and also the significance as one of the most common cancers among women today.
Aisha, just as you said earlier about the number of incidents of breast cancer, which have overtaken other cancers globally, The major attraction is that it's a female cancer per se, though it equally occurs in male. But the most important fact is that because of late presentation, lack of awareness, and also lack of experts and necessary facility to take care of that, most of the case we see here is always at advanced stage, leading to high rate of mortality. So it becomes a very challenging situation for us, especially for those who are in low and middle income countries of the world. For other advanced countries, it's equally there's high burden of that, but mortality is quite low. So our problem is peculiar in nature because of the lack of awareness and other socio-cultural factors that militate access to care.
Still talking about significance of the breast cancer. Now, let us look at, say, the risk factors. I don't want to say causes, but then let us look at the risk factors that expose women or men, like you rightly say, to this particular disease.
Well, there are a lot of risk factors, and majority of the risk factor is unknown, though there is 10 to 15% of cases that have to do with the hereditary, whereby a female may inherit some genes, abnormal genes that emanate from breast cancer, which we call it BRCA1 and BRCA2 genes, and other oncogenes that predispose a female from developing breast cancer. But apart from that, we talk about nulliparity, whereby a woman has not given birth to or has not been pregnant for after 30 years. So it's a big risk factor, nulliparity. And we talk about those who are on hormone replacement therapy, and those who are not breastfeeding, and those who are obese. If you are fat, the risk factor is increasing. And we talk about those who are exposed to radiation at early stage, especially radiation to the chest and to the neck, especially those who had maybe radioiodine and rest of them. So we equally have a case whereby we talk about those who have previous breast disease, which in case did not follow up, and those who have some cancer that's spread to the breast, which we call metastatic breast cancer. So those are the things that normally put a patient at risk of developing breast cancer.
You have talked about genetics playing a huge role. You've also talked about hormonal imbalances. What about lifestyle choices?
Yes, that lifestyle choices have to do with it. We now talked about obesity, whereby that's part of the lifestyle choices in which in an advanced country, like when I went to US, I found that the number of breast cancer is quite high because of the rate of obesity there, and there is a life of affluence. So you find out that as we are migrating, especially those who are in the urban city, are migrating into Western lifestyles in terms of eating what the whites are eating, then there are changes that are coming along with it, and also the sedentary lifestyle, whereby people hardly exercise themselves. So those are the things that are equally militating and predisposing a lot of people to developing breast cancer.
Earlier on you talked about breast cancer mortality rate more in low-income countries. Now let us talk about the role of say awareness and also early detection, and what it plays, the role it plays in people detecting early and also reduction of mortality.
Yes, currently we are, just as we are here on TV, we are already doing the work of cancer awareness campaign, and the aim is to make every woman to be aware of her breast by developing that instinct of doing what we call breast self-examination, and also subjecting themselves for clinical breast examination, and also routine breast ultrasound and mammogram, so depending on the age of the patient. So these are the part of the things that are now increasing cancer awareness. But one of the big challenge we have is that most of this is a township affair, and we are thinking of how this will be trickled down to the rural areas where the majority of the patients are not even aware of existence of breast cancer, let alone having access to some of these basic clinic or experts that are taking care of breast cancers.
you talked about self-breast examinations and also checks at clinics and all that. Now, I'd like for you to stress on how people who, you did talk about some communities who are not even, where women are not even aware of the existence of breast cancer, let alone taking preventive measures. Now, still in line of preventive measures, let us look at the role of, say, a workplace, work environment now in helping to create this awareness and also upscaling the preventive techniques. What we are going to do is majority is that for some of us who are in the health system, we normally give a health talk and we discuss this breast cancer and the risk factor extensively. But for other people, we are now looking at the role of National Orientation Agency, the radio, the TV, and other NGOs in terms of disseminating the information, creating awareness, because what is critical is information. Because when a patient is well informed, he can now take a rational decision, or he cannot be acting from the side of ignorance. So from that, I think that we are going to up our game in terms of reaching out to the people in the rural areas and using our native language to convey the information. Rather than speaking long grammars, we should equally translate some of this information in native language in such a way that we will convey the message appropriately and improve their health-seeking behavior. Still talking about early detection and preventive techniques, I'd like for you to help us, highlight more about, you talked about exercise and also maintaining a healthy weight, regular exercise, and I'm also seeing factors such as limiting alcohol intake. How does does all of those play a role? Yes,
they have a synergistic effect, in short. What happens is that the obesity have a role in pressing on a cancer-driving factor, which is the hormone, and changing some of the fat into some hormones that drive breast cancer. So when you look at that, you find out that those who are obese are at more risk compared to those who have moderate size. And at the same time, those who are feeding on fatty food, are equally predisposing themselves into developing other disease like heart disease, diabetes, arthritis, and rest of them, apart from breast cancer. So it's all of these are something that we must be aware and able as much as possible to limit our exposure to that. And alcohol is equally playing a significant role. In short, it has a general place in most of the risk factors that we name. If you talk about cancer of the colon, alcohol is there. If you talk about cancer of the head and neck, alcohol is there. Talk of breast, talk of most of the cancer cases, alcohol is there. So our limiting our alcohol intake should be critical and very important. So most of those things are combined, and they have a way of integrating themselves together to prepare a patient from developing breast cancer.
Now, we have talked about symptoms, we have talked about risk factors amongst others, and also early detection, how it plays a key role. Now, let us talk about treatment strategies. What are the available treatment strategies? Okay,
well, basic thing is that patient should be willing to subject herself or surrender herself to a hospital, a facility. And that hospital is now going to streamline what should be done and what should not be done, because we have some degrees of we have primary health center, secondary, tertiary, quaternary, and rest of them. So majority of things we do is that, first of all, we talk about examining patient. Examination, the diagnosis of breast cancer starts with examination. Patient comes, you start history, take a history of the patient, we talk about how the disease evolution and rest of them, then you examine the patient. After the examination, we talk about taking a sample from the breast cancer. You cannot declare a patient that a patient has a breast cancer until you must have taken a sample, which we call biopsy. It is the biopsy that now, which is subjected for examination by the pathologist, that is going to give us a final verdict, whether a patient has cancer or not. So, which means that not every growth in the breast is cancer. So that's why a surgeon must be careful when he sees a growth and go ahead to remove the breast. Sometimes it may lead to a lot of litigation. So it is when the histopathologist must give you a report that this is cancerous, then we now go into a different, there's other further things we do to know whether we can conserve the breast or whether it's the type we are going to remove the breast entirely. So, but not all cases that we remove the breast, there are some criteria we use. So, so a woman should not panic that she has a growth in the breast until the doctor examines it and confirms it. And that gives us the room that for every noticeable change in the breast, you have to report to the hospital for doctors to do the needful.
Now, what about the role of, say, surgery, chemotherapy, radiation therapy, and also targeted therapies? Okay, those are the further stages that we undergo. It's not every patient that comes that we must receive chemotherapy or targeted therapy and rest of them. So it depends on what we reached at diagnosis and do what we call immunohistochemistry, and we go further. So, and there are some cases whereby we do surgery only, and the patient may not even require chemotherapy or radiotherapy. Yes. Now, as an oncologist, I'd like to know, or I'd like for you to explain the role of radiation therapy in breast cancer treatment. Okay.
Radiation therapy is now one of the gold standard of taking care of breast cancer, in which most often after breast surgery, then we do radiotherapy. And what does radiotherapy do? Radiotherapy, what it does is to sterilize the area of the surgery, and it is used for most often for a localized disease and also to palliate cases. When we talk about palliation, is that a patient, we cannot give absolute cure for the patient. We can now say, okay, we can manage the patient and relieve pain and some symptoms like bleeding, like bone pain, like fungating lesions, whereby the wound, there's a wound on the breast and it's looking very, very intolerant and sometimes bleeding. So you can use radiotherapy to take care of that. And where there's a persistent pain, bone pain, you can use radiotherapy to take care of that. Okay, I'm afraid that's all we can take now. But just before we go, what are your final words for people who may be suffering from breast cancer, or people who are not even aware that there is the existence of breast cancer, or they may have it? My word is to tell them that diagnosis of cancer is not end of life, that there is already a lay-down procedure to take care of that, and if patients are able to report to the hospital as early as possible, that surviving from breast cancer is possible. Thank you so much. We have been speaking with Dr. Chinedu Simeon, who is a radiation and clinical oncologist at the National Hospital, Abuja. Thank you, Aisha. Nice to meet you. Now, it's obvious we need to push for importance of raising awareness about breast cancer and its impacts on individuals and families. And with that, we've come to the end of the program, Healthy Living on Trust Television. For comments, contributions, and suggestions, do well to subscribe. Follow us across all of our social media platforms. Join us again on another episode of the program, Healthy Living on Trust Television. I'm Aisha Salihu. Thanks for your time.